Welcome back to Science Corner. I am here with Dr. William Wallace, who specializes in health and human performance with a focus on nutritional biochemistry and exercise science. He is a co-founder of Mechanism of Action, a company advancing bioactive ingredient delivery and clinical research. His work spans solid-state delivery, trial design, and product innovation with a decade leading scientific affairs, product development, and regulatory compliance in nutraceuticals. Will, welcome to Science Corner.
Thank you, Jordan, for having me. I'm stoked to be here.
Yeah, man. And so we're going to do something a little bit unique today. And so because your background is so deep in the supplement space, you've kind of seen it all. You've run trials, you've built product, you helped brands come to market, which means that you are ripe to really talk about a lot of these quote unquote myths that we see in the supplement space. So today we're going to play a little game where we're going to throw out a myth and you're going to help us break it down and understand, is there something to this? What do we need to think about? And as a consumer, what do we need to take away from this to truly understand what they mean when it comes to our supplements? How's that sound?
That sounds great. I have a tendency to ramble on, so you're gonna have to pull me back when you're ready to rapid fire and move on to the next one.
See, I like Ramble because at the end of the day, this is all about takeaways and learning and education. So the more we can get from you, I think the better. And one of the places that I want to start and that comes up all the time is this concept of natural. And we tend to think if it's natural, it's automatically safe. Most consumers tend to equate this concept of natural with harmless. From
Mhm.
your perspective, though, where does this concept break down?
Sure. Well, I think that one thing that's an important point to get across to most people is that you can look at things as having chemical classifications, regulatory classifications, and marketing classifications. Those are all really important distinctions. And natural is really just a marketing classification. It tells you very little about something's regulatory status. It tells you very little about something chemically. Some of the most potent toxins that we know of are natural. You have ricin, arsenic, aflatoxin, for instance. So it's not enough to just ask, well, did this come from a plant? I think you have to go a little bit further and ask, what happens when you introduce this compound into a biological system other than the one from which it originated? And there's kind of a common example or one explanation I can give that people can really latch onto and understand. It's more practical, and one that's a bit uncommon. I'll start with an uncommon one. In 1992, a Belgian company put a birthworth plant extract into weight loss supplements, and it ended up being a sourcing error. They were looking for a different species from the same genus, so this was an accident. But birthworth plants have been used in traditional Chinese medicine for over 2,500 years. After about a year or so of that product being on the market, I think 39 women ended up arriving at end stage
Oh,
end
no.
stage kidney disease, essentially, and several of them had urothelial carcinoma, which is a cancer of the urinary tract, bladder, and kidneys. And what they found was that this birthworth plant had a compound called aristocolic acid, which converts into aristolactum, which is a class 1 carcinogen that's on the same
Oh,
level
no.
as it's on the same level as asbestos and tobacco smoke. And nobody realized that until this 1991, 1992 Belgian mishap. But prior to that, this had been used in traditional Chinese medicine for over 2,000 years. Later, epidemiology suggests that this has been contributing to cancer rates for over 2,500 years while it was being used in traditional Chinese medicine. So the fact that it was natural said very little about how safe it was until it was tested clinically and exposed after it was included as an extract in a Belgian supplement. So that's an uncommon example. One that people might understand more readily is vitamin C. Most vitamin C on the market is synthetic. About 70% of
Nice.
supplemental vitamin C is synthetic. It's produced through the microbial fermentation of corn-derived glucose, but it's chemically identical to the vitamin C compound that operates in our bodies. Your body cannot tell the difference. Now, you may not be taking that synthetic vitamin C in with the other active constituents that it comes with in nature and different foods, but vitamin C as a single chemical entity is one thing. And the fact that it's synthetic doesn't mean it's unsafe. Rather, it's very safe. So something being natural, a marketing classification, tells us almost nothing about how something operates chemically.
So I love that because I love that the takeaway can be almost like don't trust the word natural because like and it's more like let's think through it in a lot of different ways. I think that's a great way to kind of break that down. And so you mentioned as part of that, you also talked about early in that answer about regulation. And one of the things I hear a lot is that supplements are not regulated. And there's this consistent confusion around what the FDA does, what it does not do, what does it oversee, what does it enforce. Can you clarify how supplements are actually regulated and where do these gaps exist today?
Sure. I think you'd probably agree with me that um, whether supplements are regulated or not, it's probably one of the largest misconceptions in and around dietary supplements. So to say they're not regulated would just be factually inaccurate. That regulatory architecture does exist. Supplements are regulated through the Dietary Supplement Health and Education Act signed in 1994. What dietary supplements are not is pre-approved. In other words, if I want to bring a product to market and you're the FDA, I do not have to come to you and ask your permission to put something on the market. So there's this gap between pre-approval and then post-market regulation and surveillance where a lot of the misconception happens or where a lot of problems could happen in between. DSHEA, the Dietary Supplement Health and Education Act, classifies supplements as a subset of food, not as drugs. And that gives the FDA several concrete ways to manage those things. Namely, and one of those ways is through good manufacturing practices. That term is important because it's more than just saying, hey, we manufacture our supplements well. Those are not suggestions, those are actual mandates. It mandates that all supplement manufacturers test their incoming raw materials, their outgoing finished products. It mandates that they write food safety programs, that they have sanitation programs, that they have personal training, and that they keep adequate record keeping. And the FDA has jurisdiction to come in and audit all of that. They can pull products off the market if they deem that they have what they call an unreasonable risk of causing
Mhm.
injury or harm. And that right there is a bit of a point of contention for the reason that there's a bit of a structural asymmetry in burden of proof allocation compared to something like drugs, where pharmaceutical companies have to prove as best they can that something is safe and effective before it comes to market. Whereas for supplements, the FDA has to prove that something is likely harmful to be able to move it out of the market. But there are examples in which the FDA has done that in history.
Mhm.
You have DMAA, they've done that with ephedra, but that asymmetrical allocation and burden of proof is something that people often point to, and that's where manufacturers that are not testing their raw materials, that are adding known adulterants
Mhm.
to their products, they operate in a space between what is actually regulated and where the FDA doesn't have the manpower and the resources to regulate. And so I think that that's kind of like that's a point of contention even within the industry is that since DSHEA was signed in 1994, the supplement industry has grown 20-fold. So the honest question is that the regulatory model, it's one that is of post-market surveillance and constrained resources. The FDA simply can't audit every facility that it's supposed to with the cadence that it initially said that it would, and it can't audit every supplement label. So is it a perfect system? No, but the system does exist.
And I like that clarification too, because I think, I mean, I probably because of exactly what you just said, more facilities, more products, more brands, more things in the market, and the FDA's lack of ability to really like keep up with it doesn't mean that it's not regulated. It just means that maybe the system needs a bit of a revamp. And I think that's a really good way of laying it out because it can feel like it's not regulated sometimes because of that, but it's good to know what's happening behind the scenes. Okay, so building on the back of that, so we know that supplements are regulated. We know that they but we know that things still they come to retailers, they come to market. And so one of the things that we see a lot is if it's on a shelf, if it's at a major retailer, it's probably fine. It's probably of good quality. And so this concept of just retail presence can create this perception of vetting. And so in your perspective, what does placement actually tell us? And what does it not tell us about the quality of a supplement on the shelf?
Sure. In In some, retail placement is a distribution achievement. It's not a quality certification. So what it tells you is that a company has good distribution. It tells you very little about whether or not the manufacturer is testing their products with the appropriate analytical methods or for the appropriate stability. What's happening at the level of procurement is more of a commercial evaluation than it is a scientific one. Now, fortunately, we live in a day and age where most large retailers do now mandate some form of third party testing for things to make their way to the shelves. And like a good recent example of that is CVS, who implemented their third party testing for dietary supplements. They produced their report in 2019, and they found that about 7% of 1,400 dietary supplements they were selling were not meeting label claims. So roughly 1 in 14 supplements weren't meeting label claim. And they removed those supplements from their stores. But what they also included in their on their testing program, if you looked at their site, was that they had tested one lot from each supplement, and they could not guarantee that every lot of the
Mhm.
supplements that passed thereafter were also meeting label claim. And so that's one major limitation to some of the verification programs that you have to go through for these major retailers, is that products really just need to be tested before they make it to the shelf, and then maybe once a year thereafter. But in that time frame, you could be selling multiple lots to customers visiting that retailer, and some of those might not be meeting label claim. So the quality requirements are looser than I think most analytical chemists and like regulatory experts would like to see. The thing is when you're going to these retailers, and if your benchmark for quality is that, well, I bought this supplement from a retailer I trust, that means you're trusting their procurement department to act as
Mm.
analytical chemists, and that's not their job. So retail, it's a good indication of how well connected a company is, of how well distributed it is, but not of actual quality.
And I think that's a good note. I think, because we tend to go to the store, we look for the cheapest product on the shelf. Cool, that holds. I go with it. I think a deeper dive worth knowing, maybe correlated, not causal, as far as like quality sitting on the shelf is a good way to say it.
Sure.
And
I mean,
some
some of the initial requirements can actually be pretty steep to make it into major retailers. So if you're meeting that initial requirement, then you can make the argument it's more likely that those companies are consistently meeting that requirement. But it's not always often not a recommendation to check that you're repeatedly meeting that requirement.
100%. And so and also when I look at these products on the shelf, a lot of times the advertising will be like, this one has 2,000 milligrams of something or 1,000 milligrams, or we look at probiotics and it's billions of strains that are sitting in a container. And so these higher milligram amounts are often marketed as superior, and we get this kind of like more is better concept. Can you talk a little bit about how dose response curves actually work and where this concept of excess can actually create risk as opposed to benefit?
Sure. So this can probably be one of the most expensive misconceptions in dietary supplements, the misconception that dose response curves are linear. The thing is that biology tends not to work in linear fashion, and biology is not algorithmic, at least not in the common sense. Most nutrients display a response that follows what's called a logarithmic curve, where you apply some substrate and you see a steep increase in effect. But as the system starts to saturate, the curve starts to flatten a bit. And if you apply more substrate to that curve, then you either see negligible or zero returns, beyond which, and in many cases, that curve can then invert. That's something a little different. I think probably the cleanest example of a logarithmic dose response curve is a protein synthesis,
Mm.
where taking 4.4 grams of protein per kilogram of body weight per meal tends to maximize protein synthesis in healthy young men. If you double that dose from zero point 0.4 to zero point 0.8 grams per kilogram of body weight, then you see a very negligible increase in protein synthesis or none at all, for the reason being that you've already saturated the system requirements to hit a maximum response. Now, take that a step further, where the curve starts to invert, not with protein, but we'll look at a different example. Something like vitamin A, for instance, that's an essential nutrient. It's essential for growth and development of a fetus. But if you push the dose over 10,000 international units a day, it becomes teratogenic, so toxic to a fetus. Something like iron excess causes tissue damage. And those curves look more like U's or J-shaped curves. So biology doesn't operate in a linear fashion. I wish it did. That would make things very easy for formulators and for those of us trying to decide what kinds of things we need to take to optimize our own health. But then there's another consideration that I look at as somebody who does formulate products, and that's that it can be cheaper to add 1,000 milligrams of a generic commodity material rather than adding the appropriate amount of material, the right amount of material in the appropriate delivery format, where it's going to be best absorbed, where it's going to exhibit its best efficacy. So in that respect, 1,000 milligrams of a generic commodity CoQ10, for instance, might not be as effective as far less the dose when it's being provided in a stabilized format with an appropriate carrier, etc. So there's a health lens to look at this through, and then there's also kind of a supplement formulation efficacy lens to look at this through.
And I think this is super interesting. So what I'm hearing is that when I have my protein oatmeal and my protein cereal and my protein Pop Tarts with my protein water for breakfast, I'm probably not I'm probably over maximizing what I need to be taking in that regard. So I think that alone, I think this concept of, we hear fiber maxing, we hear protein maxing, we're trying to get in everything. I think that concept of that curve and knowing like when we've hit a saturation point is really, really important for people to understand. And I appreciate you breaking that down. One thing that you did say there, though, is you're talking about like too expensive of maybe you just throw in 1,000 milligrams of a standard amount instead of the right amount in a right form. Now, this form is something that comes up a lot. We see this with magnesium with all the different subtypes. We see folic acid with the methylated versus non-methylated. Talk to me a little bit about nutrient forms, or how meaningful is this? And does this really matter when it comes to real world outcomes?
This is probably the first question here you're asking me. Any of these you could take up an hour, 2 hour conversation on. This is a particularly deep can of worms. So it depends how deep you actually want to go into those, especially the two that you mentioned, because those are probably the most discernible or recognized differences in vitamin or supplement forms, at least for the average person. What I can say as a general umbrella statement is that form does and can matter, but it is often overstated through marketing, often far overstated through marketing. And magnesium is the best example of being overstated. Does form matter for magnesium absorption? Certain forms of magnesium are more well absorbed than others. Organic forms routinely show better absorption than organic forms like magnesium hydroxide, like magnesium oxide, etc. But when you look at efficacy data in people, pretty much every form of magnesium has data showing that it supports magnesium status in some capacity. Magnesium oxide has several large clinical trials where it shows efficacy in sustaining magnesium status. Now, it's not obvious that every form would be best to pull somebody out of a deep magnesium deficit. In that case, it might be good practice to recommend, well, you take a more bioavailable form. But when it comes down to it, what's the best form of magnesium? It's the one that you can tolerate, and it's the one that you can afford. On the flip side, you brought up folic acid. That by itself that's a widely contentious topic. Folic acid, which is a synthetic oxidized form of folate that is not found in nature, and then you have methylfolate, which is the known active form of folate. There's so many things that we could talk about here, but what I will say is that folic acid, despite all of the myths and contentions that surround it, probably has the best public health profile of any supplement to ever exist. And in that respect, it's probably the most effective dietary supplement that has ever existed. What I mean by that was in 1991, there was a clinical trial produced on or published on folic acid that covered about 33 different centers across 7 different countries. And they found that it reduced neural tube defects by 72%. That's the kind of result that shifts public policy, regardless of where it's happening in the world. And so in 1998, dietary folic acid fortification was mandated. And since it's been mandated, neural tube defects in the United States have reduced by over 30%. So in that respect, it's the most successful public health intervention in the history of natural product interventions that are applied at population scale. Now, could you make the argument that, well, methylfolate is more active for several reasons, or methylfolate is more useful for all of the reasons people argue against the MTHFR mutations, the competition for folate transport and receptor activity? You can make an argument that something like folic acid might be more useful in some people. Now, there isn't data in humans to support that, not because it's not the case, but because nobody's had to run those studies because folic acid has been so successful in those studies. But mechanistically, you could make the case that folic acid isn't going to be best for everybody, especially at every dose, and likewise for methylfolate. But even if somebody has a preference over methylfolate because it's an active form, that does not dismiss or eliminate the fact that a different form like folic acid does have some use in people. You can say that same thing about different magnesiums. I might say that I like magnesium glycinate the best because I can take somewhat of a lower dose and get a greater absorption of magnesium. Plus, I'm getting some of that glycine ligand, which I like. But that doesn't mean that I can say magnesium oxide is useless. It's not.
Hmm. Yeah, I like that. I like that a lot because I think we, a lot of people, we want to think black and white, right? Magnesium glycinate is good, oxalate or citrate is bad. This is the only good. And I think that concept of understand, and I like the concept of trial and error. We know we are all are kind of in of one study, and so being able to take, maybe you try the oxide or the citrate and it doesn't really sit well with you. Maybe you don't digest it as well. You try the glycinate, it feels better. I think that's, or you have these multi magnesium blends that people are trying now. I think that concept of playing with different forms, trying them, not going hog on one, and play, and kind of understanding how your body responds to it. Fiber is another good example of this. Is really important when it comes to supplements and building out people's, like, their journeys and their stacks. One of the things I want to talk about as we move along here. So you are a scientist, and one of the things that you and I both see in the space a lot are these big headlines that say a study showed this. Omega-3 cures heart disease. Uh, Berberine is just as good as GLP-1s. So this concept of, if a study shows benefit, the supplement works. You see these single studies that drive enormous interest. How should we be thinking about replication, population, overall evidence strength before relying on these big headlines when it comes to studies?
Sure. Yeah, it can be kind of like a single piece of evidence can be kind of dangerous, in the hands of the wrong person or through the eyes of the wrong person. Because when you have any published trial, all you can really say is this has been shown this one time in at this time in these group of people at this dose with this specific compound. That's how the interpretation is supposed to work. A good metaphor to use would be looking at it as like it's a puzzle piece. And now
Mhm.
you have like the greater topic. We talk about something like um, the NAD precursor space, for instance. That body of literature as a whole is a puzzle, one of which that we don't even know what it looks like ultimately when it's finished, but it's a puzzle. And every individual study is a puzzle piece that goes into that. My wife and I we love to do puzzles. We've been on a puzzle binge for the past like 2 to 3 months. And I don't know what got us onto this binge, but it would be aching, like looking at one study and making a conclusion about the larger body of evidence would be like taking one piece of that puzzle and looking at it and be like, yeah, and I can tell you exactly what this is going to look like when it's all mapped out. And you simply can't do that. Most times, excuse me, when something is shown once, it's very common that it's not replicated. And the NAD space, NAD precursor space is a perfect example. There are instances where NMN and NR do show functional improvements in submaximal efforts, like a 6-minute walk test, like a
Mhm.
sit and stand test. But those studies are very rarely replicated, especially in different populations than the ones that they're studied in. NAD precursors have shown some effect in some instances, one particular I can think of, to have vascular benefit, sometimes in metabolic benefit and triglyceride lowering, but those studies have yet to be replicated. Typically, when supplement studies are replicated, and when most studies are replicated, what happens is the effect sizes actually start to shrink, even when you get successful replication, because the initial studies themselves, they tend to be smaller in duration, smaller in population. So when you find a positive signal and you go, okay, we need to replicate this on a larger scale to ensure that we can to ensure that this is happening consistently, effect sizes tend to shrink up with recurring publications. Then maybe publication bias can shrink up a little bit, but initially you can't really you just can't take one piece of evidence and then extrapolate to consistency or extrapolate across populations. So a single study, it can be a useful piece of evidence, a very useful piece of evidence, but it's far from conclusive.
Yeah, I love the puzzle piece analogy because I mean that's such an easy way to think about it. If I was to take 1,000-piece puzzle, if I was to pick up one piece, let's call that one study, you get almost no, maybe it's an eyeball, maybe it's a color, maybe it's a maybe oh this is an edge piece. That's all you can really discern from that, and I think that's kind of a beautiful way of putting that together, and hopefully helps us not just digest headlines as fact, and maybe we start to think about them a little bit more or less aggressively and more in a total body of work. All right. So on this concept of research and discerning that, one of the things that we see a lot is we see this one study. If the supplement works, it should work for everyone. Oh, I saw that berberine reduces triglycerides. I have high triglycerides. I better take a berberine. There's an expectation of universal benefit. Talk about things like there's genetics, there's baseline status, the microbiome, lifestyle, all that shape these individual responses. So help us understand this concept of how do we understand when a supplement works? Should it work for me?
It's funny because you just nailed the answer in the question. Um, the three major determinants of effectiveness or efficacy from person to person are: one, baseline nutrient status; two, gut microbiome composition; and then three, genetic makeup. When you look at baseline nutrient status, I think iron is a good example. Iron is between two, and iron supplements as a category, they have a bioavailability of 2 to 35%, depending on the form you're using, depending on somebody's baseline iron status, and depending on whether or not it's taken with food. In the right person, in somebody who's nutrient depleted, then iron can rescue hemoglobin. It can rescue ferritin. In somebody who's already iron replete, well, like we had mentioned earlier, that can cause that kind of overburden with iron can cause tissue damage.
Mhm.
As it comes to the gut microbiome, that's a whole nother layer of complexity that is really only just beginning to be understood. I don't think people really appreciate how little we know about the gut microbiome and how that influences nutrient absorption, how it influences nutrient status, even. One good example of how variable different supplements and nutrients work through the gut microbiome is urolithin A. That's
Mm.
become an increasingly popular phenolic metabolite that's produced by the gut microbiome. It's produced when oligotannins are metabolized by certain gut bacteria, oligotannins from pomegranate or things like walnuts. And about 40% of the population does not have bacteria present to actually produce any relevant amount of urolithin A when they ingest pomegranate, when they ingest walnuts. So that rule pretty much holds up across numerous different polyphenol-based products, plant-derived compounds. You'd say the same thing for curcumin. You can say the same thing for quercetin. You can say the same thing for different ashwagandha compounds. Gut microbiome influences the absorption of pretty much anything you take, whether it's coming from a plant, whether it's an essential vitamin or mineral. Beyond that, look at genes. And I think one example that everybody can get on board with is caffeine. You have
Absolutely.
the CYP1A2 gene, and for people who are slow metabolizers, you could have caffeine in your system 8 to 9 hours later. For people who are fast metabolizers, then you burn through most of that in 3 to 4 hours. Now, only about 10% of the global population is actually a slow metabolizer in caffeine. Actually, close to half of the population is actually a fast metabolizer, and about 40% is kind of a moderate metabolizer. But genes affect metabolism of so many different things. I think caffeine is probably just a prime example that everybody can understand readily.
I like that, and I love the urolithin A note. So I wrote an article for Supco on this exact concept not long ago on a lot of people just can't produce it, and because of this exact reason that you talk about. And I think most people will have no idea. And the question is just like, well, do I have these bacteria? We really don't know. There's not an easy way to test for that for right now. And so I think it's so important to be able to understand these nuances behind a supplement like urolithin A is expensive. And so if you are, making an effort to buy it and you can't produce more food, like there's so much to understand under the hood. I think I think that's a really great explanation
Well,
of how to
I also
think
think
about yourself.
there's another good example, and that's isoflavone metabolism and absorption. Like, you can't absorb most isoflavone-based compounds if you don't have equal metabolizing or equal producing bacteria in your gut, and that changes drastically between populations. That changes drastically all over the world, and and isoflavones are a very common bioactive found in soy product.
Yeah, I think I think there's so much, and we're only talking about a few examples here, but there are so many other examples we could go into, and it's just so important. Like when you start taking a supplement, especially something you're paying a lot of money for, do your best to understand it. Understand, even if you can't really understand your own microbiome to a degree, understand why that supplement works, how it's supposed to work, why it may or may not work for you, what the study says. It can only benefit you and your pocketbook. So one other thing I want to talk about before we close up here. One of the things that we hear a lot about is price. We see brands that will creatine, I think, is a really good example of this right now. We see creatine priced 40, $50 and the same amount, $15 that you could go buy on Amazon. It really runs the gamut. And so price is this concept of like, if it's a higher price, it must be better. From your experience, is that true? What actually makes a meaningful difference in making these products more or less expensive?
So it can be true, but what I would say is that price as its own factor is such a poor proxy of actual supplement quality, if we're going to use the word quality as a kind of a stand-in for premium. In many cases, or actually here, I'll give this example. You could have a product that is filled with commodity ingredients that are quite cheap, and it can be wrapped in a nice matte black soft touch label, and you can have a product that has the exact same commodity ingredients at the same doses, costs the same amount in a very generic label and packaging. The former is sold for $60, the latter is sold for $15. And oftentimes, the one that's sold for $60 will outcompete the one that's sold for $15. So, what supplement companies, I think what any company can do, whether it's a supplement company or not, at times can exploit this common cognitive bias called the quality price heuristic. The idea that something that's more expensive is necessarily better, and it's not the case. In some cases, you might be paying a premium for the way a product looks as opposed to paying for actual superior ingredients. The fact of the matter is, some of the most expensive, I'm not going to say who they are, but some of the most expensive supplements on the market, who you and I could both probably name, are using very cheap materials just wrapped in very pretty packaging. It doesn't mean that the supplements don't work, but it means that you're paying for presentation over superiority, or at least another type of superiority, ingredient superiority. I think actually, here's a really good example of where products using commodity ingredients tend to be overpriced as a rule. And that's in the MLM space, the multi level marketing. products are routinely priced 3 to 10 times over what they would be otherwise, because there has to be pricing baked in to support layered commission levels. So what people ultimately are paying premium price for are commodity ingredients that would be sold way cheaper otherwise. And in that case, you're paying for a distribution model instead of actual superiority.
So I think that's great because as a consumer, I mean, maybe you do want to pay for a pretty supplement cabinet. Maybe
Sure.
there's something that you feel good about. You open those doors, but I think the concept of knowing like you're paying for packaging or you're paying for distribution and not necessarily an increase in quality that hopefully if there's anything to take away from this chat, like that's such a valuable piece. We know people's pocketbooks are really tight these days. Having that understanding, I think, is incredibly important. And so I want to close up shop here with this. But the last thing I want to ask you, William, I want to get a little bit more personal on your stack, and I want to know what is one supplement that you cannot live without. What's your non-negotiable, and what's one supplement flying under the radar that you wish more people knew about?
It's actually really, it's probably the most difficult question just because like you, I'm a massive supplement guy. And so it's like they're all my babies, and it's like hard to choose between one. But I think that for one that I can't live without, I don't want to sound like an influencer shill, but it's hard to argue past something like creatine because the evidence base is what it is for it. In my own life, I try to prioritize things like physical performance, and creatine is the gold standard nutritional intervention for improving performance in conjunction with exercise. I think that the neurological implications of taking creatine are interesting, but I wouldn't go as far as to even say compelling yet. It's still early stage and we can't say too much there, but I think it's interesting enough to lean into a little bit. But from a
Mhm.
physical performance standpoint, from a bar that has been set with the amount and the quality of research that's been done with that ingredient, it's hard to argue past that one. So I think creatine for one that I can't live without.
What's your dose? A 5 gram, 10 gram, 20 gram? Where are you at these days?
I fluctuate.
Okay.
Average is 5 grams
Okay.
every now and only not because like is more better. I'm not in the camp that's saying, well, more is necessarily better. Again, I think that the brain reasoning, usually why people take a higher dose is, the brain claims. It's far too early stage and far too premature. Nobody's ever shown that creatine is actually making its way into brain tissue, and the mechanism in the brain has even been called into question. So I'm fortunate to be part of a group of people who are at the moment trying to actually advance the our understanding of creatine and the creatine literature in that space. But 5 grams for me most of the time, and not because I don't think that more can be useful at times, it probably can, but like yourself, I'm also a pretty busy guy. And sometimes I just have to take things first
Yep.
thing in the morning and then last thing at night before I go to bed. And I'm not thinking about my second dose of creatine during the day.
Makes sense. Makes sense.
As for the supplement that flies under the radar, I think for me, that's lithium.
Oh, okay.
Lithium orotate specifically because that's the supplemental form. But lithium has some of the most, you say what you want about epidemiology, lithium has some of the most impressive and consistent epidemiological findings for any nutrient that's out there. From a mechanistic standpoint, I find it very alluring.
Okay.
And I love mechanisms like as much as the next guy. I try not to lean into those as hard as some people, but I love a good mechanism. And the mechanisms are intoxicating, which is kind of a funny pun if you understand anything about the therapeutic window of lithium for use in mood episode recurrence. But I would say that lithium is the one that flies under the radar for me. I think that it has the potential to show extraordinary benefit for day to day functioning in people that has yet to be realized. So we will see if I'm proven right there. But creatine, the one I can't live without, lithium under the radar.
I love it. We got a staple and we have a hot take. That's a perfect way to close out. Dr. William Wallace, busting myths in the supplement space. Thank you so much for joining Science Corner.
Thank you, Jordan.